Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today I thought I'll talk about a different topic, IBS or Irritable Bowel Syndrome. Irritable Bowel Syndrome is a disorder which affects your GIT tract or your gut, and it is usually associated with a group of symptoms which include stomach pain and cramp, too much of gas formation, frequent stools, and even weight loss. And according to the WHO, 15% of the population is affected by this condition. So how do you think this IBS is formed? Usually the food that enters your mouth will go through a series of processes for the proper assimilation and digestion. It travels from stomach, then to the intestines and then to the anal canal, and it comes out as stool through the anus. This process or the movement of the food inside our stomach is controlled by the rhythmic movement of the intestinal tract, which we call it as peristaltic movement. If there is any dysfunction in the rhythmic movement of the intestinal tract, we will end up in IBS or irritable bowel syndrome. Here, the food is required to stay in the gut for a specific period of the time so that proper digestion and assimilation happens. So, here what happens is the food will be rushed from one place to another because of the increased mobility of the intestinal tract, and that's how the frequent motion is happening. The motions can be usually normal, semi-solid or watery, along with too much of water, gas and even mucus. So because of the increased mobility, the food will not have proper time for the digestion and absorption to happen naturally. So definitely there will be malabsorption, weight loss will be involved, and also fermentation of the food can also involve. So too much of gas formation also will be there. If you look into the symptoms of the IBS, it will come in a wavy pattern where there is an active phase wherein the symptoms are involved, and there will be a latent phase where things will be normal, and then with one trigger it will happen again in the next period of time. So now let us look into the causes or what are the triggering factors of IBS. So definitely family history, stress factor, one of the most important factor, some infections, especially after the corona you can see that the cases of IBS are quite in the high rise. Some medications, abuse, physical, mental or sexual abuses can trigger IBS. Then definitely food intolerance. These are some of the reasons why the IBS is formed. So if you look into it, there is a bit of a problem in the coordination from the brain and the gut. So this disease is also called as brain-gut dysfunction. So now let us see the treatment side of IBS. So in allopathy, there is no definite treatment for IBS. We can manage it symptomatically for a period of time. But beyond that, there is very little scope in allopathy for the treatment and cure of IBS. So that is the reason why a lot of diet and lifestyle changes are recommended for the treatment of IBS. Basically for the IBS, there is a specific recommendation to reduce the FODMAP foods. FODMAP food is a very detailed diet recommendation and I'll be doing a special video regarding that. Basically, the idea is to reduce the highly fermentable and high calorie foods. That includes processed meat, red meats, and milk products has to be avoided, and stimulants like coffee, alcohol and smoking has to be avoided. Sugars and processed food has to be avoided. Some fruits and vegetables like watermelon, apples, onions and garlics. So these food also has to be avoided. In homeopathy, we have successfully treated and cured many IBS cases, especially after corona, because we have medications to treat the triggering factors of IBS, which may include stress factor or family history or any food intolerance or anything which causes the triggering factors. We have medications to cure. In homeopathy, we will take a detailed case and figure out like what exactly is causing the IBS, and we will treat the primary cause of it so that the patient can have a permanent cure. So this is regarding the IBS. If you have any doubts or queries, you please message us and comment us so that we can get back to you. So if you really like this video, you please make sure to like, comment and share, and also please don't forget to subscribe. Thank you so much for watching.